Bismillah ar-Rahman ar-Rahim. My subject is a histology of cardiovascular system presented by Tabarak Ali Abdul Kadhim. The cardiovascular system, the heart and of blood vessels, the blood vessels اللي هي arteries and arterioles and the capillary and venule and veins. Arteries bring blood from heart to different organs or tissue. Arterioles divided to form the network called capillaries, which pervade with tissue. In some organ, capillaries are replaced by sinusoid. The blood form capillaries or sinusoid is collected in the venule, which unite to form veins. Veins bring blood to heart. Now, this slide shows the layer of artery. This is the endothelium, and this is the internal elastic lamina, and this is the media, and this is the adventitia. Now, the basic structure of arteries. The innermost layer, tunica intima. It consists of endothelial lining, a thin layer of glycoprotein called basal lamina. Delicate layer of subendothelial connective tissue. A membrane formed by the elastic fibers called the internal elastic lamina. 2. The tunica media, elastic tissue or smooth muscle, limited outside by the membrane formed by external elastic lamina. 3. Tunica adventitia consists of connective tissue in which collagen fibers are prominent. This slide shows the layers in the wall of the typical artery. This is the tunica media, and this is the endothelium. This is the basal lamina. This is the subendothelial connective tissue, and this is the tunica adventitia, and this is the external elastic lamina. So, now the type of the arteries. We have two types of arteries. First one, elastic artery, and the second one, muscular artery. The elastic artery, it is the large artery in the body, like aorta, pulmonary trunk with the subdivision, branchocephalic common, carotid, subclavian, vertebral pulmonary, and common iliac. Tunica media is made up of elastic tissue. Some smooth muscle are also present in media. The subendothelial tissue contains more elastic tissue. This slide shows us first one, the endothelial lining, and this is the tunica intima, and this is the tunica media, and this is the tunica adventitia. Now, this is the cross section of elastic artery of the aorta. Now, this slide, it is also show us the tunica intima, the tunica media, and the tunica adventitia, and this is the connective tissue, and this is the epithelium, and this is the internal elastic lamina. Now, the muscular artery, they are continuation They are continuation of elastic artery, predominate smooth muscle in tunica media. Muscle fibers are arranged circularly. Connective tissue are also present between the muscle fibers. So this is the internal elastic lamina, and this is the tunica media, and this is the tunica adventitia. This is the muscular artery, this is the tunica media, and this is the tunica adventitia. We have the comparison between the muscular artery and the elastic artery. This is the media, tunica media. It's filled up in the muscular artery, filled up of smooth muscle, and the media in the elastic artery filled with elastic tissue. Now, arterioles. The muscular artery having a diameter less than 100 micrometer are called the arterioles. muscular arterioles diameter تكون من 50 إلى 100 micrometer. Lack of the internal elastic lamina, a few layers of smooth muscle. The terminal arterioles diameter يكون أكبر من 50 micrometer. A thin layer of smooth muscles fiber in the tunica media. This is the arterioles. And this slide shows us the arterioles, and this is the large arterioles, and this is the small arterioles. Now, capillaries. The terminal arterioles are continuated into the capillary plexus. The arrangement of the capillary plexus and their density varies. In the wall of the capillary, there are a lining of endothelium. Endothelial cells are lined outside by the basal lamina. Overlying the basal lamina, there may be some prevascular cell, اللي هي precyte. Capillary are two types, continuous and fenestrated. The continuous is the edge of the adjoining endothelial cell are fused, like in muscle, skin, lungs, and brain. Fenestrated approaches are present in endothelial cell, like small intestine, endocrine gland, and kidney. Now, this is the slide show us the capillary, and this is the endothelium. Now, sinusoid. These are also network, different from the capillary. The wall of sinusoid contain only the endothelial cell covered by the layer of connective tissue. In some places, the wall is incomplete. The lumen is broader but irregular than capillary. The sinusoid are found in organ, which is made up of cords of cell like liver, spleen, suprarenal gland, and pituitary gland. Now, this slide shows us the histologic sinusoid in the liver. This is the sinusoid in the liver. The veins. Basal structure is same as artery. The wall of vein is thinner. A presence of abundant collagen fiber in medial layer. The smooth muscle fibers or elastic fibers reduce. The tunica adventitia layer is thicker. Significant amount of elastic fiber and also the muscle fibers in adventitia. There is also there is no distinction of 3 layers, especially in a small vein. Now, this is the slide show us the small vein. This is here the small veins, and this is the small artery, and this is the tunica media. This is the tunica media, and this is the tunica adventitia, and this is the venule. This is the nerves, and this is the arterioles. Venules. Smallest vein which drain from the capillary are called the venule. Diameter من 20 إلى 30 micrometer. The wall consists of endothelial lining and basal lamina and a thin adventitia. The wall is very much permeable, especially lymphocytes and other cells may pass out into the bloodstream. This slide shows us the venule, and this is the basal lamina, and this is the endothelial lining. Now, the heart. The wall of the heart made up of 3 layers. The inner endocardium, a middle myocardium, and the outer epicardium. The endocardium, simple squamous epithelium, and the thin subendothelial connective tissue. The myocardium, thickest layer, and it consists of cardiac muscle fibers. The epicardium consists of squamous mesothelium and underlying subepicardial layer of connective tissue. The subepicardial layer consists of a coronary blood vessel, nerves, and adipose tissue. Now, this is the coronary artery. This is the coronary artery. And this is the subendocardial connective tissue. And this is the endocardium of atrium. And this is endocardium of atrium. And this is the cardium connective tissue. Now, this is the epicardium, and this is the myocardium, and this is the endocardium. Now, the atherosclerotic lesion, increasing in thickening of antenna, proliferation of smooth muscle cells, increased deposition of connective tissue fibers and lipoproteins. Macrophages engulf lipoproteins. Thickening includes vessels. Now, this is section. It is the atherosclerotic plug in coronary artery. In the coronary artery, which is a block the artery and cause angina and infarction. And thank you.